Live here. Live video now. Thank you, brother.
No problem.
Good morning, everybody, and welcome to Intellectual Medicine. Thanks for tuning in. Yes, we are flying without Shannon again this morning. She's busy working, keeping everything together in her professional life, where she has been running the Intellectual Medicine Center for the past 2 weeks, as I've been unavoidably detained, one might say. So today we're going to be talking about a whole wide range of topics, and we're going to build on our theme of petrified thinking versus intellectual medicine. Petrified thinking is the antithesis of intellectual medicine, the antithesis of intellectual life. Petrified thinking is when you have a predetermined thought or opinion that refuse to let it alter despite the input of new information. It is the reason for a lot of our fire lines, politically speaking. We're going to draw connections between what's happening in China, where they have re-education and vocational training for people that have toxic thoughts. How'd you like to have a toxic thought? Have a knock on the door and the government comes and takes you away so they can help you with the way that you're thinking, which isn't congruent with the way that really normal, healthy people think. There's an element of that runs through medicine. We'll be talking about that today and how it affects your health, and that's how it affects your life, how it affects your freedom, how it affects the information that you process. We're going to talk about hormones, and about the South African runner who was banned from women's competition because her testosterone level is too high. Is it right? What's the relevance of that? And what does it say about our hormone levels and what we should do? And we have to, immunizations have been in the news. The good ship measles has been floating around the Caribbean. We'll have to talk about that. And we're going to talk about the lumping and splitting dynamic. Lumping, when people put everything into one common bucket, and the split is where you look at things in a more discriminate fashion. And this kind of ties into the petrified thinking a little bit. And today we're also going to tell you about what you need to do. I'll give you my opinion about how to interpret the chaos regarding breast cancer screening. Yeah, got a new producer out there. It's Jake behind the glass. And mark your calendars next week, if form holds. We're going to have a wonderful guest, a gentleman who is been diagnosed with terminal cancer. He's been told he only has a few months to live. And I think that it'll be an inspiring story, an inspiring example, as well as a bit of a chilling insight into the ways that, I'm going to call it therapeutic coercion, in the ways in which some patients can be subjected to a form of therapeutic coercion in the absence of a full range of balanced, informed decision making. All right, getting ready to ramp up here, gang.
Program has been paid for by Dr. Stephen Petteruti. It is for entertainment and basic information purposes only, and is solely responsible for its content. It does not reflect the views of Cumulus Medium, WPRO, its management, or its staff. Talk 630 and 99.7 FM, WPRO presents Intellectual Medicine with Dr. Petteruti. Join Dr. Petteruti as he guides people towards living the 120 lifespan while retaining youth. He'll apply logic, reason, and scientific evidence to address issues that drain people of their joy and vitality while protecting people from the harmful aspects of conventional medicine. Now, here's Dr. Stephen Petteruti.
Good morning, everybody, and welcome to Intellectual Medicine. You are tuned in to one of the greatest radio stations in the nation, WPRO FM, and you happen to be listening to one of the most intelligent radio shows on the radio, Intellectual Medicine. Thanks for tuning in. Thanks for your faithful listenership. Well, today we need to talk about what makes our area great, what makes our state great. We're going to be talking about, would you like it if your teachers were packing a weapon like they can now do in Florida? What's good about that? And is it something that is helpful even? In Rhode Island recently, physician's assistants are on the path toward being granted independent status so they can be your family doctor. Is that good or bad? We're going to render an opinion on that. We're going to also talk about breast cancer screening. What should you do? The American College of Physicians, the ACP, came out with updated guidelines. That adds to the chaos. We're going to talk about that. I'll give you my thoughts and opinions on it. And yes, we have to talk about immunizations again, or still. We're going to talk about the good ship measles that's plodding around the Caribbean right now. Boy, how'd you like to be on that ship? Free. I wonder what they're doing for those people. So here's the story, right? There's a cruise ship bobbing around the Caribbean with passengers who have been infected with measles. And by and large, the population on that ship does not endorse measles immunizations. So the entire ship is a floating petri dish. How would you like to be on that boat? Or better, or worse yet, what do you do? What do you do with the boat itself? Who wants to dock it and let those people offload? That's a concern. And, we're going to talk about this paradox, the idea that some immunizations are super valuable and almost critical, and others not so much. And we're going to have to talk about the dengue fever immunization. The FDA just approved a new immunization. It's called Dengvaxia, Dengvaxia. It is an immunization against dengue fever, endemic towards some tropical regions of the world, including American Samoa, Puerto Rico, and others. It's sometimes called break bone fever because, well, the pain that it induces. Little problem on the way to making this a universal immunization in those areas. Turns out the risk of the immunization is greater than its benefit. And we'll talk about that in the way that the lack of discriminatory thought regarding immunizations actually harms the immunization movement. But first, we got to take a look around the state and the country. Here's good news. What makes Rhode Island great? I'll tell you what I like about it. I like that it's so damn small, right? It's easy to get around. I can move from point A to point B. I don't have to drive very far. I can ride my bike to work. I can find a fine restaurant in a short distance from my home, and you can too almost anywhere in Rhode Island. I think what makes it great, it's kind of a funky little state. Creativity, I love that. Creativity requires freedom. And finally, it's the bay. It's the bay. It's the environment. We love our bay. We love our beaches. And it's proximity. Rhode Island is nestled between Boston and New York. It's a great place. So why are we not thriving? Why are we not bursting at the seams with abundant success? There's a universal sense amongst the people I talk to that Rhode Island succeeds in spite of its leadership, by and large. So let's go to the evidence. U.S. unemployment in the United States is at a 49-year low. A 49-year low. In the month of April, we added 263,000 jobs. Who do we have to thank for that? Whose economic initiatives are helping with that? Huh? What do you think? Who do you think? Donald Trump, maybe? He has something to do with it? No, Tyler, it's not your success. Although congratulations to Tyler. Our producer got promoted here at WPRO. He's going to be joining the morning show with Gene Valicente. Tyler, we'll miss you, but Jake, you got big shoes to fill. But listen, back to the issue at hand, though. The national economy is burgeoning. It's exploding. What's happening back in Little Rhode? 2,800 jobs were lost in the first quarter of this year. 2,800 fewer jobs in the state of Rhode Island. What is going on? Why is the country booming and Rhode Island is sucking wind? Oh, it's all a matter of how you cast it. We're on the right path. We just have to continue what we're doing. Crony capitalism. Let's hand out money to certain companies so we can get a photo opportunity. Never mind the fact that the infrastructure, the economic infrastructure, the environment of economic growth is stiflingly bad and is not being addressed. People are leaving the workforce in Rhode Island, so the unemployment rate looks about the same. That's wonderful, isn't it? Fewer jobs, fewer people working. If you're a poor sucker that's working every day and paying your taxes, you're getting a sore back from carrying the load. Now we turn to Providence, the city of Providence. Do not feel comfortable because you're looking at Providence from the outside in. Don't seek to see for whom the bell tolls. It tolls for thee. Pawtucket, poor Pawtucket. First Central Falls, now Pawtucket. The hospital closes. The Paw Sox leave. Hasbro's going, baby. They are going. What's left in Pawtucket? Who's next? The dominoes are falling. Providence, $1 billion debt in their pension fund. And here's what the mayor had to say. Quote, this is from the Providence Journal Bulletin. It's hard to motivate the political will, end quote, to effectively change the formula. Really, Mayor? You are the political will. Is it hard to motivate your will? It's unpopular, but this should be addressed. The politicians too often are just holding their breath, looking for the next job. All you have to do is hang in there long enough to get elected out of the state. Look at Cicilline. What did he do to help Providence? Not as much as Providence did to help springboard him to Washington, where he doesn't have to worry about the looming collapsing deficit. Not to worry, though. We're going to put washing machines in the school, and somehow that'll fix everything. Maybe we could do some money laundering with those washing machines, pay all the debt. People, the point is, we must address these core issues. You don't tax truckers. They are the lifeblood of economy. They are the thing that moves the economy forward. You want a robust port? Are you going to tax the trucks that go to it? If you're thinking of growing a business, are you going to really put your flag in Rhode Island? And this affects our health. It affects our health indirectly by corroding our economic solvency. Now we have to talk about the hospital system. It's Care New England that wants to merge with Brigham's Health. What does that mean to us? Why should we care about this arcane story? I'll tell you why. I'll give you my thoughts and opinions on that. But first we have to take a short break. When we come back, the Care New England Brigham's Health merger. Whether or not you should be on hormones is down the line. And if so, how do we know what dose? And finally, are the Florida teachers going to be packing weapons? And what about Rhode Island? I'll be right back. This is Intellectual Medicine. I'm Dr. Steve Petteruti. You know, I'll clue you guys in right now. So picture this. You're at work and you get a frantic text from your child who's in elementary school, and the text is active shooter. Is your first thought, wow, I'm glad they made that a no weapon zone because I'm comforted that there are no weapons except for the weapon the shooter has? Or in that moment, would you be happier if somebody in that school possibly had a weapon to shoot back with? Which of those two scenarios makes you more comfortable? Now imagine you're in a church, you're sitting in the pew, and a guy busts through the back of the church and he's firing a weapon at everybody. And 8 people stand up with their weapon and shoot back at him. Is that better or worse than nobody in the building is armed? I get it. In a perfect world, there's no weapons anywhere. We love one another. Nobody's shooting other people. This ain't a perfect world. This is the United States of America. We have made decisions to value freedom, and freedom has risks and hazards. The Second Amendment means there will be more deaths by shooting in America than other countries. That's what the consequence ends up being. Suicides, murders, yes, random drive-by shootings. They're going to happen more often. I'm not being cavalier. I'm not saying that we should passively accept it. I'm saying it's a fact that you can't compare the United States to other countries. Now, if you want to argue to reverse the Second Amendment, that's a legitimate argument to have. But if you want to argue that we should disarm the law-abiding citizens because somehow that will curb the death rate from weaponry, that's just illogical. And death is what we're against. We do not advocate death. Stay tuned on our Facebook Live. I'll be announcing the date for the epic 60-year-old bench press event. That's right. So in China, they put people in concentration camps. Oh, wait. I'm sorry. They're education and vocational re-education centers. That's what they're called. And they do that if you're having toxic thoughts. It's a preemptive strike on the Chinese government to try to cut down on terrorism and crime. How do they know if you're having a toxic thought? Well, if you say something on social media that they don't like, you'll get a knock on your door. Come with us. You know, I've been accused of being toxic in my thoughts. That is, there are some who don't like our philosophy and our approach. There are some who feel that the objective of living a 120-year youthful lifespan is fraudulent and misleading and shouldn't be talked about. There are some who feel that complementary care for cancer, such as mistletoe and vitamin C, shouldn't be talked about, or at least should only be talked about in a manner that they see fit. This, people, is a creeping encroachment on our freedom of expression and thought as it manifests itself in a medical world. There are some people who don't think that you should speak negatively about certain immunizations, because to do so can confuse the public. You, the people of Rhode Island, are deemed to be easily confused, easily duped, and really not that bright. So you need the government to step in and defend you. You need authoritative figures to step in and defend you. You know, in intellectual medicine, we value and respect your intellect, your ability to discriminate, your ability to make sense out of relatively complex issues. So let's talk about some complex issues today, shall we? Bear with me, my intelligent listenership, because I expect you to be able to discriminate. And I'm inviting you next week, if form holds, we're going to have a guest on who has terminal cancer, and it's a utterly fascinating insight into how the cancer diagnosis and treatment options roll in front of an individual at that critical moment of life. And it's an utterly educational and enlightening insight into the decision-making process of an individual and a family. A most courageous guest, a show not to be missed. That's going to be next week on Intellectual Medicine. And Facebook Live, we're going to be back. We'll be back on Wednesday at noon. You may have noticed we were absent this Wednesday. I was unavoidably detained, having to defend myself against accusations of unprofessional conduct because of the things I say and the way we do things, in part. Fortunately, we had a pretty good outcome. We look for engagement with our critics. We seek conciliation with our critics. Critics are good. They sharpen your thought and your argument. So let's turn now to the issue at hand. One of the issues at hand. Care New England, Kent Hospital, and its affiliates are looking at, in effect, selling out to Brigham's Health out of Boston. Now, let's look at the history. My grandfather was a barber in East Greenwich. He donated $25 when they were raising money to build Kent Hospital. He did that because he believed in the local resource, and he wanted it to be there for his family, his children. He wanted, like many others, to not have to go to Boston. Now, what's going to happen? Oh, they'll give you reassurances that this is good. This is good for the economy. It's good for the people of Rhode Island. Well, those are the reassurances we heard when Care New England bought out Pawtucket Memorial, and it promptly closed. If you're a corporation, you want to cut expense and boost profit. One way you do that is by consolidating services. I predict that if this goes through, more and more services will go to Boston and will move out of Rhode Island. I told you, one of the things I love about Rhode Island is how small it is. It's very nice to be able to get your chemotherapy, to be able to get your surgery right here in your backyard. It makes economic sense to go to Boston, but it's not in keeping with our culture. So a lifespan in Rhode Island Hospital, they have a point that this could be a harm to Rhode Island long term. An equal harm, however, would be those two hospitals, Care New England and Lifespan, merging. A unified or monopolistic healthcare system would absolutely corrode your freedom and your options. pause in a moment and you tell me, when has a monopoly ever been noted for great service, great customer service, and wonderful pricing? Imagine for a moment if Stop and Shop, Dave's Marketplace, and Whole Foods announced that they're going to all merge into one huge grocery store, and it's going to be for the good of the people because they'll be able to coordinate delivery of food. Really, people? You buying that? Are you buying that? You don't think they're going to drive up prices? You don't think if you're a nurse and there's a monopoly of employment, they're going to beat up your wage? You're going to have trouble finding a job if you don't fit in? If you're a doctor, you're going to have trouble if one entity doesn't like you and another is part of the same corporation? No, this is a bad deal. We invited Care New England representatives to come on our show. We have not heard back. I'm waiting to be convinced that selling out to Boston, and besides that, I want my dividend. My grandfather put $25 in. Here it is, 70 years later, and they're selling out at a tidy profit. I wonder what that $25 looks like today. Maybe everybody who chipped into that hospital should get a check when they consolidate. Another piece of news, physician's assistants in Rhode Island are moving toward independent practice. Some have opposed this. I say good for them. We need more primary care. Now, having said that, there are always going to be levels of skill and experience. There's always going to be a doctor who's a little bit more experienced and capable than a peer. It's not to say that everybody needs to be the same. I've often said in medicine the most important thing to know are your limits, because we work collaboratively. Even us at Intellectual Medicine, we reach out to our colleagues in the mainstream of medicine because we need them. We're all connected. And PAs properly trained with proper experience can be an asset in primary care. Just as nurse practitioners, although I will say nurse practitioners go through a longer and more rigorous training, and it's worthy of looking at these training pathways. Shannon is a nurse practitioner with extraordinary experience. She's been studying at Intellectual Medicine for many years. She's deeply skilled in hormonal management, anti-aging therapy. Simply put, she is unique in the nursing practitioner field by virtue of those skill sets. So yes, we're in favor of the PAs being independent. We're in favor of the nurse practitioners being independent. It's funny to me how a PA can work for a doctor and the doctor can make money off that labor, in effect, hardly ever, if not seeing those patients at all, and yet when they want to go independent, some people oppose. So we're on board with that. What about this other issue? We're talking now about guns in the school. So in Florida, they're making it legal for teachers to carry weapons. In Rhode Island, they're trying to move to ban weapons from schools and other public places. Think about that for a moment. Now, in a perfect world, there are no weapons, there are no guns, nobody's shooting and killing. In a perfect world, we live in harmony. In the United States of America, we have decided, we've made a conscious decision to swap out harmony for freedom to a certain extent. The Second Amendment allows the bearing of arms. That is a unique provision. With it comes an inevitable consequence. That is, there will be more shooting deaths in America than in countries that don't have any weapons. That is a fact. You can't compare us to other nations. I'm not saying we should be cavalier about that, nor that we ought to not attempt to diminish the consequence. It's just going to happen. Now, picture this. You're sitting in church, and a guy busts in the back door and starts shooting. Are you feeling good at that moment that your church is a no weapon zone area? Picture another scenario. You get a text, a frantic text, your daughter's in high school and there's an active shooter. Are you comforted that they passed a law in Rhode Island making the school a no weapon zone? Or would you feel just a little better if there was a possibility that there were people in the school, teachers, civilians, law-abiding citizens, carrying a concealed weapon who could neutralize a shooter? Person bust in the back of the church. Are you gonna be happy when 8 people stand up with a weapon and shoot back? Recently, a poor kid lost his life at University of North Carolina, Charlotte, tackling a shooter. He's a hero, and he deserves to be honored. But boy, how much better if he could have just pulled out a weapon. Again, a perfect world, there's no shooting deaths. We're not in a perfect world. We're in the free, loving United States of America. We cannot impose laws with a good intent but a bad consequence, because people's lives are at stake. So, healthcare, yes. Economic growth, essential. Defending ourselves in a weapon-carrying society? I say yes. I think it's, well, I'll almost say this much. It's almost a law-abiding citizen's civic duty to own a weapon and to seek a concealed weapon permit so that we can have more good people ready to neutralize a threat. Now, we have to take a break in a moment. But when we come back, we're going to be talking about the South African runner who's banned because her testosterone level is too high. What is too high? Should women be on testosterone? Of course they should. The only question is at what age should they start? We'll talk about why when we come back. We're going to talk about what you should do with the new information, the new recommendations about breast cancer screening. But first, from the Revolution Softwash News Center, it's Doug Lizette with the headlines. Hey gang, we're on low battery mode. I gotta do this. There we go. Okay, so we're on low battery mode. If it goes dead, I apologize, but I'm technically limited here without Shannon around to help keep things running right. So PAs, right? I love my fellow PAs. Here's my advocacy. If a PA is your primary care doctor, then they should have at least 3 years in the field. If not, they're not ready, in my opinion. The same thing with most nurse practitioners. Experience is a game changer. I'll go a step further. I'll say that chiropractors and naturopaths should be enabled to be your primary care provider. Who says primary care has to be connected to the ability to give you drugs? A good naturopath knows when to refer you because you need drugs. But we are overdrugged. We're overdrugged in large measure because of the way medicine's delivered. Now, when we come back on air, I'm going to tell the story about the dengue-vaxia. Dengue-vaxia. It's an immunization for dengue fever. And it's a bit of a parable about the arc of drugs, their marketing, their development, return on investment. And it's a cautionary tale for us all when it comes to new things coming to market that are purported to be the next great thing. So I'll hold on that because I want to share it with the wider audience when they come back. So yes, it was a fascinating couple of weeks for us at Intellectual Medicine. There is an attempt on the part of some of my colleagues to see what we are talking about effectively stifled and modified. And as I mentioned, these are not bad people. They're intelligent people. They're good clinicians. They just don't possess the same fund of knowledge. They don't study the same information that we do. And they have a differing opinion. Well, differing opinions are healthy. What's unhealthy is when you rush to judgment in the absence of communication and reflection. Fear breeds ignorance. Ignorance and fear create bias and discrimination. Because it's new, it will be opposed. That's just one of the thermodynamic laws of human behavior. That which is new will be opposed. Intellectual medicine is innovative and new. We expect some opposition. We're always hopeful it'll be a tempered and thoughtful opposition, and such has not always been the case. Anyhow, we got to talk a little bit about our beloved Celtics and Bruins are in the playoffs right now. I have a feeling the Bruins are going to go to the Stanley Cup Final, and here's why. They're just a better team than their opposition. Every now and then they kind of take a night off, and you get that sense like they won a critical Game 4. They're tied 2-2. You get the sense they can put it in gear when they want. Kind of like the Patriots last year. Really, how motivated can you be if you're Tom Brady and the Patriots, and it's week number 4, and you're 3-1, and all the other teams in your division are horrible, and you're going to the playoffs? It's really hard to ratchet up to the highest level of intensity. So now you've got the Boston Celtics. I'm not so confident about them. They lost a home game. That's poison. Now they've lost their home court advantage, and we'll find out, game 4 coming up, if they have that extra gear that great teams have. I just don't think they do. I think they get eliminated by Milwaukee. I think Milwaukee showed what they're made of by winning that game in Boston. Now on to the Red Sox. They're going to be there at the end of the year. They're too talented. They're too deep. They have too many good starters. They're not going to continue to play this poorly. And here's my prediction for the Patriots drafts. Their receiver they drafted, he's going to be the next Jerry Rice. I love this kid. He's 6'2.5". He's strong. He bench pressed 225 27 times. He has big hands, and he catches the ball in traffic. Like Jerry Rice, good hands, big and strong. I just think he's going to be that good. We just got to take care of Julian Edelman, and then we'll be all set. There you go. A sweeping overview of sports. All right, here we go.
6 seconds. Now back to intellectual medicine with Dr. WPRO or 1-800-321-WPRO.
And we're back again, people. It's Dr. Petteruti here at Intellectual Medicine, flying solo this week as Shannon, otherwise occupied in her studies and her work. She is one busy human being. Our son Owen is playing lacrosse this morning. And our other sons, Joshua and Ethan, played last night, where a bad call by the ref gave Portsmouth a fluky 7-goal victory over them. But it was an exciting game. Well, yeah, that's a high school varsity, so they're both, very exciting. Oh, no kidding. It's a great town, and they have fantastic sports programs. Did you go to Portsmouth High School? Yeah, it's a wonderful town. Portsmouth, it's one of those towns I was referring to, Jake, that can look at Providence and say, I'm glad that's not us. But the rolling wave is coming, baby. It's going to hit us all. We're not, Rhode Island, Rhode Island is not really a state. We're a county in the state of New England. Did you know that Rhode Island's the only state in New England that lost jobs in the last quarter? The only state? Something's not right. I love our littleness, but sometimes we get a bit provincial. We can no longer look at Providence and say, well, we're good. We're East Greenwich. We're Portsmouth. We can't look at our local high school and say, wow, it's better than the neighboring town's school. We have to look regionally, and that's something I think we on occasion lack. So here's one of my political, and then we're going to get to immunizations. We're having this issue at the southern border with Mexico. Should we build a wall? Should we build a wall? We've really developed a bipolar political system in America, Democrats, Republicans. So here's my proposal. What do you think about this, people? We take Mexico and we annex the whole country. Just take it over. They don't know how to really run their country. The place is a mess. So we take it over. And more specifically, let's how about this? We let the Republicans run Mexico, and we let the Democrats run the United States, the Northern 48, we'll call them. And in 10 years, we'll see how each nation's doing. The red-blue dichotomy. What do you think? Mid-19th century. Well, listen, there's division. Now we've got red and blue states. And I'm curious about this. I'm going to have to study it. Texas is booming. It's a red state. Rhode Island is sucking wind. It's a blue state. I wonder if there's a parallel, color versus economic development. California sucks wind. It's a blue state. Florida's thriving. It's a red state. I got to move off this topic, though. We have to get to immunizations. So the good ship measles is floating around. And here's what happens with petrified thinking. By virtue of forcing too many immunizations down our throat, the healthcare authorities risk a blowback. They risk a counter-proposal. So I'm talking now about the value of getting measles immunization. But if you, on the other hand, are forcing people to get immunized against every immunization that comes down the pike, in Rhode Island, one of the only states in the nation that is forcing children to be immunized against human papillomavirus, an immunization that is sexually transmitted, that cannot be transmitted through a cough or a sneeze like measles, a disease that has no chance of afflicting an elementary school kid. It's an overreach. It creates pushback. It creates suspicion. And here's another thing that creates suspicion. Dengue fever. 2016, Sanofi, a company out of France, spent 20 years and $2 billion developing an immunization against dengue fever. They launched it around 2016 against the opposition of a lone voice in the wilderness, Dr. Scott Halstead, who had studied dengue for 50 years as a member of the U.S. military. And he wrote to anybody that would be willing to listen, this immunization has potential harm. We need to move cautiously. They ignored him. The company wrote opinions neutralizing his criticism. And this immunization became compulsory throughout the Philippines. Unfortunately, it caused death and it caused harm. And they realized, as they observed this, that Dr. Halstead was right. The immunization was more dangerous than the disease in many cases. $2 billion, 20 years of research, despite evidence and warnings from experts in the field, launched on a public. There's a message here regarding new drugs in general and new immunizations in particular. Now, immunizations should be held to a higher standard because you give them to healthy people. There needs to be an exceedingly low level of risk. There needs to be exhaustive levels of experience. There needs to be honest reporting of consequence. In my opinion, unless there's a critical risk to the population at large, I'm talking pandemic level risk, immunization should not be compulsory. They should be studied for a generation, especially if it's a non-aerosolized infection. So rather than shelve this immunization, remember, $2 billion speaks loudly. The immunization was released by the FDA in the United States. Back in 2016, the World Health Organization recommended that all children between the ages of 9 and 16 receive Dengvaxia. Oops, sorry guys, it was hurting people. Wait. We have a new recommendation. In 2017, the company published new information saying, well, it's okay to give. If you've already had the infection once, it'll help prevent you from getting it again. Really? We're going to trust you now? We're going to believe that you're not looking at ROI, return on investment, as opposed to public welfare. So we need to be cautious when it comes to drugs. A new drug always comes to market with a lot of energy and excitement. It's the greatest thing since fill in the blank. Slow down. I like old generics. If you get medicine, overdiagnosis, overtreatment, too many drugs, too many surgeries. Patient of mine recently went in for hernia surgery. Hernia wasn't bothering him, wasn't causing him pain, but it was there. Doc said, look, we might as well fix that now when you're feeling good. 2 months later, suffering daily pain, excruciating stabbing discomfort in the area where there once was no pain, but just a minor hernia. Oops, sorry. Another example of overtreatment, overzealous interventions by well-meaning individuals. Patient of mine went into the doctor, had both knees replaced, 2 knees replaced at the same time. Bad arthritis. Went into total kidney failure. Turns out that he just wasn't robust enough for his body to handle the surgery. Now he's on dialysis after having both knees replaced. How'd you like that swap? These are issues not to scare you away from healthcare at large, but make you cautious. Get multiple opinions. Move slowly if somebody wants to put a knife to you. Move slowly if they want to put drugs in you. Move slowly regarding breast cancer screening from the American College of Physicians, breast cancer guidelines. Their guideline states if you're under the age of 50, there's more harm than benefit by getting a mammogram. More harm than benefit if you're below the age of 50. I agree with them. Mammogram is a horrible study. It's non-specific, and it makes anxiety, and it makes for a lot of biopsying and a lot of chasing of shadows. Now, here's a quote, and this is from a summary of the same information. Quote, regardless of a woman's age, mammograms did not reduce all-cause mortality. Regardless of age, mammogram does not help you live longer, period. So why do them? That's my thought. Now, the American College of Physicians goes on to say, between the ages of 50 and 74, you should do it every other year. Now, what they don't say is how to discriminate between who benefits the most and who doesn't. Simply put, your body shape and size matters. If you're overweight and you have D-sized cup, there's a lot of tissue to look at. It's very hard for you to feel a lump. A lump could grow 2 or 3 centimeters and you might not ever notice it. That is a scenario where doing a mammogram may make some sense, because we know obesity is a risk factor for breast cancer. Now let's look at a woman who's, let's say she's 53, she weighs 135 pounds, she has B or C cup size, lean, easy to examine breast. There's no place for a lump to hide. The value of a mammogram, in my view, diminishes precipitously depending on your body size and shape. Not so much based on family history, unless you have a unique gene risk. Family history is not a good predictor of breast cancer risk. Most breast cancer happens in people without a family history. So my bottom line on mammograms is they are thoroughly optional. They should never be compulsory. You should not feel pressure to get one. The evidence regarding their benefit is mixed at best, and you are not being negligent of your care if you opt out altogether. Listen, when we come back, we're going to talk about hormones, testosterone in women. Should you be on testosterone? I'll give you the answer when we come back. This is Dr. Petteruti. You're listening to Intellectual Medicine and WPRO, the voice of Southern New England. Yeah, so there you go, mammograms. And people ask me, what about thermography? Tell them the same thing. There's no evidence of its benefit. You get a thermography, which is looking for alterations in heat expression in the body so you can correlate it with possible cancer or possible disease. No evidence that it's going to help you. Furthermore, you're still left with shadows that you have trouble interpreting. If you're lean, you're fit, you're healthy, self-breast exams is what I'm recommending. I advocate everybody to get their heavy metal tested. Cadmium is widely found throughout our part of the country and is a carcinogen and can correlate with breast cancer in particular. Obesity correlates with all forms of cancer. If you're a non-smoker, your number one form or your number one risk for acquiring cancer, if you're a non-smoker and you're overweight, is extra fat cells. So that must be addressed. In many cases, it needs to be addressed with medical treatment because your metabolism won't let you lose weight on your own. That's a real common phenomenon for patients. The other risk factor, heavy metals and toxins.
It's that time of year, all the bachelor and bachelorette parties. How about getting your guests, bridesmaids, and groomsmen to the church, to the wedding venue, and back to the hotel? Professional Security offers transportation for 7, 14,
Yep.
24 passengers, and they have a Cadillac.
So I hope you guys are holding up okay through all this mucky weather. I have never seen anything quite like it. Just a constant drizzle. Well, the only good thing about it is it gives me an excuse to do nothing on the weekend. You know, I can't do anything in the yard because it's just too wet and mucky. So I get to just kind of hang out and read and write, which is one of my hobbies. And next week, we're going to have a guest on the show who has a terminal brain tumor. He's going to be talking about his diagnosis and experience and the way in which he interacted with healthcare and made his own decisions. And in 2 weeks, Shannon and I are going to be in Florida, where I'll be giving a talk to the International Conference on Anti-Aging Medicine. The topic of my talk is intravenous vitamin C and mistletoe, its role in secondary prevention of cancer. Now that talk we hope to make available to you all. It's meant for my colleagues, but I think it's got value to the public at large. And ironically, it's a topic, one of the topics that I'm being criticized for is my theory and my support for secondary cancer prevention. So that talk is coming up in Florida. I'm very honored to be having been invited to give that talk, and it's really ironic that at the same time I'm being honored with a bully pulpit on an international platform. I'm having to spend money to defend myself against accusations of unprofessional conduct in Rhode Island for talking about vitamin C and secondary cancer prevention. I don't know. It's what we believe. What we believe. You know, why do we talk about it in the face of risk? Because we want you to know about it. We want you to have that information so you can make your own decisions. Okay. About 30 seconds. We're back on air.
Living a healthier life.
Spending time together as a family.
It's where I go to learn and play after school.
Immunizations.
Strengthens communities.
By helping kids reach their full potential. Encouraging healthy living.
10 seconds. Inspiring social responsibility.
Get involved. Find a Y near you. Visit ymca.net.
Now back to Intellectual Medicine with Dr. Petteruti. Call in now at 438-WPRO or 1-800-321-WPRO.
The countdown continues. 20 more days. Yes, people, 20 more days until my birthday. Oh, good. I do love exaggerating its merit. I will be 60 and it feels great. So at 60, I feel better than I did at 50. There will be a Facebook event. We'll be announcing the time and the date where I will be attempting to bench press 300 pounds as a way to thumb my nose at the notion that with aging comes declining function. In intellectual medicine, we believe in a rectangular lifespan. What does that mean? It means at 40, 50, 60, 70, 80, you remain functional, independent, feeling great, strong brain, strong body, strong bones, strong sex drive, good sexual function. Yes, that's important. If you want that, it's got to be there. That's how you want to live. You know, we'll be talking with our guests next week. The cornerstone element is not necessarily how long we live, but how well. Look, I want both, right? I want to go 120. I don't want to have the consequence of aging afflict me. So let's talk about hormones, right? Because hormones are essential to anti-aging medicine, but they are not the full spectrum of what it takes to live well and live long. Without them, you will suffer. You will corrode. Everybody at some point in their life, in my opinion, and that of many other experts in the anti-aging field, needs to be on hormones or they're going to suffer. Now let's look at Caster Semenya, the South African Olympic gold medalist who was banned from competing in women's competition because her testosterone level is too high. What? How absurd. How ridiculous. As if a committee can decide what level is right. And here's why everybody should be on testosterone, especially women. Ladies, if you're not on testosterone by the time you're 50, you really should be reflecting on why not. Testosterone levels decline from late 20s and early 30s, and they continue to decline throughout your life, both men and women. Women in general are more hormonally sensitive than men, and the consequence to them is more devastating. Loss of confidence, loss of brain power, memory declines, brain fog increases, recall slows because testosterone receptors in the brain help to enhance neurotransmission speed. You know, how fast those electrical impulses move. Muscle mass declines, fat mass increases, mid-abdominal fat expands, sex drive declines, vagina gets dry and small and shrinks, These are all consequences of hormonal diminution. You could still be menstruating. You could be in your 40s and you can have these symptoms affecting you. And you may be thinking, well, it's due to stress. My kid's going away to college. My mother's sick in a nursing home. I am stressed. That truly is a factor. But the stress often, in our experience, is amplified by declining hormones. Now let's turn to Caster Semenya, the South African runner. The point is that what's appropriate hormone level for one person is not for another. And you cannot tell by virtue of a blood test whether or not you need hormones. You cannot tell. You can't do a test and say, well, Mrs. Jones, your testosterone level's in the normal range, therefore you don't need testosterone. Do you know what the normal range is for women? In the lab that we use, the low end of the normal range of testosterone for women is listed as 0, as in none. That gives you an idea about how little we know about appropriate hormone levels. Here's what cannot be easily measured: your receptors. So you can measure the amount of testosterone in the system, but you cannot measure the receptors. Therefore, you cannot measure how effectively that testosterone is affecting your function. In order to do that, you need to analyze symptoms, and that really gets to the heart of functional medicine. Those of us who are in the field of functional medicine, including Shannon, who's at Intellectual Medicine, and her expertise and this is important. Many women would prefer talking to a woman who's an expert in hormonal management. And Shannon Petteruti is one of the leading experts in the nurse practitioner field in bioidentical hormone replacement therapy. I offer that to the women who would prefer consultation and conversation with someone of their own gender. So back to this story. This poor woman is now banned just because she has an organ. That's like banning a guy from the NBA because he's too tall. It's a genetic trait. Maybe you ban someone from the NFL because they run too fast. This is ridiculous. You can test, genetically you could test whether or not somebody is a genetic male or female. That would be more apropos than looking at blood levels and hormone levels. So testing a hormone level, if you're feeling symptoms of low hormones, fatigue, brain fog, loss of motivation, declining muscle mass, increasing muscle pain, increasing joint pain, these can all tie together. Then you cannot use a blood test to make the decision. Prague Conference, I'll put this on our website. The Prague Conference was a gathering of specialists from all over the world, and they were studying androgen therapy, testosterone therapy. Now, in this case, they were studying it in men. And their conclusion was that the weight of evidence does not support that testosterone increases prostate cancer risk, nor does it support that testosterone therapy increases heart disease risk. Now, those are two of the major areas of concern in my patients. Those that are not fully versed in the risk-benefit of testosterone therapy will oftentimes say, what about prostate? What about the risk for my heart? Well, the compelling bulk of evidence doesn't support a correlation. Now, true, there are studies on both sides of this equation. And ultimately, we have to make our own decisions with the information at hand. But I will tell you, I've been on testosterone since I was 48, when I started to feel the symptoms of low testosterone affecting me. And I love what it's done for me to maintain a youthful, dynamic, and healthy lifestyle. And as I mentioned, it's more than just, gee, how muscular are you? How much weight can you lift? That's not the point. The point is always being the best version of yourself. The point is to compare yourself today to how you were 10 years ago or 20. And there should be hardly any change. You should be functionally about the same. And if anybody ever says to you, well, you know, for your age, flags should go up. You should be cautioned that they are preparing you to accept degradation in your function and your health as an inevitable consequence of aging. I love my patients who come to me that are feeling good, but they just want to stay there. That's part of what we do, functionally holding people together, reversing the declining pathway that they're on. So we do this every week. We talk about topics in medicine, topics in healthcare, topics in economics. In order to live well, live long, you must have economic vibrancy. That's why the environment is so important. The political and economic environment is so important. It's very hard for you to exceed the measure of your community. If you're in an impoverished area, it's hard for you to achieve wealth. If you are in a disease-riddled area, it's harder for you to maintain vitality. We in Rhode Island, southeastern New England, and the United States at large live in the greatest time in the history of mankind to live. Anti-aging medicine is real and expanding. We'll share those advances with you every week. Until next week, people, I am Dr. Steve Petteruti on WPRO, the voice of Southern New England, wishing you 120 youthful years. Why not 120? Well, I'm on board. Are you? What are we doing to get there together? Yes to hormones. Yes to chelation. Yes to living lean. Yes to advancing cellular anti-aging. Yes to listening to our radio show. And noon on Wednesday, our Facebook Live. Thanks, everybody, for tuning in. I'll get to your questions over the next week. See you then.
9 o'clock. Good morning. I'm Doug Lizette. The hospital in Jacksonville, Florida was prepared for the worst. A Boeing 737